A warning for public health. Former CDC Chief Susan Monarez speaks out, shedding light on a potential crisis. In a startling development, Monarez, recently fired from her position as head of the Centers for Disease Control and Prevention, CDC, has issued a dire warning to the American public. She claims that the nation's public health system is heading towards a critical juncture, with Health Secretary Robert F. Kennedy Jr. and his anti-vaccine advisors at the helm. Monarez, along with former CDC Chief Medical Officer Deborah Oury, painted a picture of turmoil within the health agencies. They described instances where Kennedy and his political advisors dismissed scientific data supporting vaccine safety and efficacy. The consequences of such actions could be severe, with Monarez predicting a resurgence of deadly diseases like polio and whooping cough, which have been largely contained for decades. I fear preventable diseases will return, and our children will suffer needlessly, Monarez stated before the Senate Health Committee. The firing of Monarez. Monarez revealed that Kennedy demanded her resignation if she refused to endorse new vaccine recommendations, which are set to be released soon. She claimed Kennedy provided no scientific backing for these changes when she requested evidence. He told me he spoke daily with the president about altering the childhood vaccination schedule, Monarez added. Republican Senator Bill Cassidy, a physician and committee chair, listened intently to Monarez and Oury's accounts. He clarified that Kennedy expected a schedule change despite lacking scientific support. Controversial decisions ahead. During the Senate hearing, Democrats, who had initially opposed Monarez's nomination, questioned Kennedy's motives for her firing. Senator Bernie Sanders suggested Monarez was dismissed for prioritizing public well-being. Monarez confirmed that her refusal to sign off on recommendations without evidence and her reluctance to fire senior CDC officials without cause led to her removal. Kennedy has denied Monarez's accusations, but acknowledged demanding firings. He claimed Monarez admitted to being untrustworthy, a charge she denies, while some Senate Republicans have expressed concerns about vaccine availability and childhood vaccine decisions. Others have supported Kennedy's distrust of health agencies. Senator Roger Marshall, a doctor from Kansas, questioned Monarez's vaccine philosophy, while Senator Tommy Tuberville suggested Monarez's loyalty should be to Kennedy, not science. America deserves better, Tuberville stated. The Senate hearing comes just before the vaccine panel's meeting in Atlanta to discuss COVID-19, hepatitis B, and chickenpox vaccines. The panel's recommendations, which must be endorsed by the CDC director, could have significant implications for public health. I'm anxious about the outcome, Monarez said of the upcoming meeting. The future of America's public health hangs in the balance, and the decisions made by this vaccine panel could shape the nation's well-being for years to come. What do you think? Should science or politics guide these critical health decisions? Share your thoughts in the comments.